topic is pulpal diseases. The clinical classification of the pulpal diseases is based primarily on the symptoms. It could be inflammatory diseases of the pulp, that is the pulpitis, which could be reversible pulpitis or the irreversible pulpitis. Then comes the pulp degeneration, and the pulp necrosis. So first, let's talk about the reversible and the irreversible pulpitis. Let's talk about the reversible pulpitis. It's a mild to moderate inflammatory condition of the pulp. It can be caused by any agent that is capable of injuring the pulp. It may be caused by trauma or due to a thermal shock while preparing the cavity with a dull burr, or it can be caused by the excessive dehydration of a cavity. It can be caused by any chemical stimulus, that is, for example, the sweet or sour food. It can be caused due to the caries. So when the caries are limited to the enamel and the dentine, then the pulpitis is reversible. But if it involves the pulp, then the inflammation becomes irreversible. Talk about the symptoms of the reversible pulpitis. It is characterized by the brief and sharp pain that is specific to stimulus, which means the pain is relieved on the removal of the stimulus. It is most often brought on by the cold food rather than the hot one. It doesn't occur spontaneously. And doesn't continue when the stimulus is removed. Treatment of reversible pulpitis is the removal of the stimuli. That is, if caries are present, we'll go for restoration that will bring the pulp to the healthy state. If the reversible pulpitis is not treated, it will result in the bacterial involvement of the pulp. Which will result in the irreversible pulpitis. Now the irreversible pulpitis can be symptomatic or the asymptomatic. Symptomatic irreversible pulpitis, also known as the acute irreversible pulpitis, and the asymptomatic one, also known as the chronic irreversible pulpitis. Symptomatic irreversible pulpitis exhibits the spontaneous pain that is, the patient will complain of lingering, sharp, piercing pain that may last. The patient may also complain of postural pain that is caused due to the increase in the intrapulpal pressure. When the patient changes the position from the standing to that of the supine. The patient may also complain of the nocturnal pain. That is, the patients are often awake at night by the pain. Let's talk about the treatment of the irreversible pulpitis. In irreversible pulpitis, the pulp tissue is significantly damaged and it will eventually die even if we remove the cause. Therefore, the treatment will be the root canal treatment for the irreversible pulpitis. And if the tooth is grossly decayed, that we cannot save the tooth, the periodontal health isn't good, then we'll go for the extraction in such cases. Summarize the differences between the reversible and the irreversible pulpitis. In reversible pulpitis, the tooth is capable of full recovery after the irritant is removed, but in irreversible pulpitis, there will be no recovery even after the removal of the stimulus. In reversible pulpitis, the pain subsides on removal of the irritant, while in the irreversible, it persists even on removing the irritant or the stimuli. Then comes in the reversible pulpitis, the pain is of shorter duration, while in the irreversible pulpitis, it may last for minutes to hours. In irreversible pulpitis, the patient complains of the postural pain or the nocturnal pain. The patient is unable to sleep at night due to pain. The treatment includes in reversible pulpitis as the removal of the irritant. That is, if the caries are present, we'll go for the restoration and the pulp will return back to the healthy state, While in the irreversible pulpitis, even if we remove the stimuli or the irritant, the pulp is significantly damaged and it will not be reversed. So in that cases, if we can save the tooth, then we'll go for the RCT, that is a root canal treatment. And if we cannot save the tooth, that it is grossly decayed or the periodontal health isn't good, then we'll go for the extraction. So this summarizes the difference between the reversible and the irreversible pulpitis.